The first thing I'm doing is I'm identifying the central part of the liver. Now on the screen we can see segment number 1 in the middle of the picture. Above it we have segment number 2, and above the portal structures we have segment number 3. So over here we actually have the left liver lobe, which we can scan and follow all the way out to the tip, and you can see the central parts separates segment 2 from segment 3, and segment 1 is the lobus caudatus, which is placed underneath. Then if we go into the tip of the left liver lobe here, then we have this little mass, which we can see as a blurred area here, which we're going to end the procedure taking a biopsy from. However, we will continue our search for other irregularities in the liver. Centrally here we have the portal vein, the branching between the left and the right portal vein. In front of that we have segment number 4. Beside it here to the right in the patient we will have the large right liver lobe, and on the back side of the liver here we can see the diaphragm as the white line, and in front of that we can see the metastasis, which is the subject for this surgery. At this stage we have to search for the vena cava and the more superior part of it here, where you can see the junction of the 3 liver veins into the cava. We have the medial liver vein here. We have the right liver vein branching here, and then we have the left liver vein leaving to the left here. So we are very interested in this segmentation because we will have segment number 4 in front of this medial liver vein. We will have segment number 8 in the area between the right and the medial liver vein, and actually behind the right liver vein we will have segment number 7 in the more cranial part of the liver. When we go more downwards caudal, then we will pass the central structures as we are seeing here, and we will also be able to see the gallbladder, which is coming here in segment number 4 in front of it here, and segment number 5 laterally for it. And if we continue more to the side, then we are actually getting the liver towards the diaphragm and the ribs, and in the top part of it, the more cranial part, we will have the metastasis. Then we have the segment number 6 is the more caudal part of the right liver lobe. Then I end up by looking in the retroperitoneum, and we can see all the structures here behind the liver. We have segment number 1 isolated in the middle of the image now, the aorta pulsating to the right, the vena cava standing still to the left, and the columna in the lower middle part of the image. Then we have the branching of the portal system here. That is one of the methods you can use to scan the liver segment by segment.